Hello, this is Dr. Neil Baum from New Orleans, and I would like to take about 7 minutes to share with you some suggestions on creating a very positive first impression on every new patient that enters your practice. In this video, I will cover why a first impression is important and follow with 4 examples of creating a positive first impression. So why are first impressions important? For the most part, the first impression that you create is the first time a patient will interact with your practice. This is an opportunity to create for the patient a positive impression of the practice. And if the good impression is stellar and unique and special, you will find that patients will tell others about that experience, and it will serve as a marketing vehicle for your practice. Suggestion number 1, the telephone. Let's compare 2 scenarios. First one, the phone rings 10 or more times. The patient is directed to a phone tree, and the first human that they hear is doctor's office, please hold, versus the phone picked up in less than 3 rings. They speak to the receptionist immediately, who answers good morning. This is the name of the practice. She or he identifies him or herself and offer to be of assistance. I can assure you, and you probably know full well, that the impression you create in the second scenario is likely to be very positive, whereas the first scenario is likely to turn off the patient. Another unique suggestion is to have the phone answered in the following fashion. Welcome to Grand Rapids Urology. The word welcome will certainly attract the attention of the caller. When the caller hears just that word welcome, that caller will know that the practice is unique and special. Number 2, prepare the patient for the first visit. Receptionists should try to identify the reason for the visit and direct the patient to educational material on the website. This is an opportunity to recommend that the patient complete their demographic and insurance information before the first visit, and this will facilitate the visit and they will spend less time in the reception area. Also, recommend that the patient complete the health questionnaire before their first visit. You also want to remind the patient that a specimen will be requested at the time of their first visit, and you recommend that they consume ample amounts of fluids before they come to the office. Number 3, be on time, especially for first patients. They will no longer appreciate waiting more than 15 minutes to see their doctor or beyond their designated appointment time. The point I want to make is that you need to respect patients' time. Unless you are doing something that is very unique and special and you're the only game in town, you will find that patients will not tolerate excessive waits to, 1, get an appointment or waiting for a long period of time in the reception area. Number 4, create a 30 to 45 second customized video, especially for each new patient. Let me share a sample of one of those videos. Hello, Mr. Kirkland. My name is Dr. Neil Baum, and I'm one of the 4 urologists at Grand Rapids Urology, and I would like to welcome you to our practice. In order to prepare for your first visit, I would like to direct you to our website. www.gru.com. And there you can complete your health questionnaire prior to your first visit. I would also like to remind you to bring any reports, tests, or studies that may be related to your urologic condition. I also would like to remind you, you will be asked to give a urine specimen on your first visit, so please consume plenty of fluids prior to arriving in the office. I look forward to meeting you, Mr. Kirkland, in early April. Thank you. I can assure you, if you create this 30 to 45-second video and have that emailed to the patient, it will be the only kind of welcome to the practice package that they will have ever received. I know a few urologists who have used this concept and have taken just a minute to create this on Zoom, and they have reported it comes back with favorable results. Finally, we have to recognize that it is important to make a good first impression on every patient who enters our practice. This can easily be accomplished with the telephone, the website, and a customized welcome to the practice video. I hope you have found this video on the importance of the first impression useful. If you would like more information on the first impression and the script that I use for creating that video, you can reach me at the email address shown on the last slide. Thank you.